introduction to those who are here to share their emerging perspectives. Just to begin, we had brief bios, but let's check in. Let's have a moment to bring all of our panelists' voices into the room and just really get started with a very, an introduction of like, how do you want to, express yourself and share who you are today? And maybe you can share a bit of a story, Yifan, Sami, and Akshata, about, what inspired you to pursue arts and health? How did you get here? How did you get in this room? Who would like to go first?
I could go first. I'm muted already. Okay, hi everyone. Good morning, good afternoon, good evening, depending on where you are. It's such a pleasure for me to be here. I'm so excited. This is such a rich conversation and such an amazing audience. And so far, the event has been amazing. I'm so thankful for being here. So my journey in arts and medicine, or in arts and health, as we now call it, started in Lagos, Nigeria in 2017. I was a part of the Global Arts and Medicine Fellow. At the time, it was just Arts and Medicine Nigeria. So it's now become something global. It's now become something that so many people here are now a part of. But then it was just Arts and Medicine Nigeria. Now it's Global Arts and Medicine Fellowship. So doing that while in medical school exposed me to the day-to-day effects that arts could have on health, arts could have in medicine. So quite a number of times, a part of the program included actually going into the hospital and, having arts and health sessions with the people who were in the hospital at the time. And that was so amazing for me because I like to tell people that my mind was blown by how much change there was seeing the patients first minute. I mean, some of these people were people I knew that I was taking care of from the medical aspect, so to speak. So some of these people were actually my patients. And then coming in as an arts and health practitioner and seeing how much effect, how much change was happening, and seeing how short a time, how effective it was, how efficacious it was mind-blowing to me. So it kind of made me, first of all, it made me very interested, like, okay, how exactly can we ensure that this gets to everybody as fast as possible? And then secondly, it also it sparked a conversation in my head. It made me want to know from the scientific aspect, how exactly is this happening? What exactly is causing this to happen? Because we came with just paintbrushes at the time. We came with just paintbrushes and a canvas. Some other sessions, it was just one musician. And seeing that much change, I wanted to know, okay, what exactly about the art was causing this mind-blowing effect. So that's how I got here. And then so far, it's been since 2018. So it's been meeting people, doing the research, doing the work, trying as much as possible to raise awareness, and also integrating a lot of what I've seen in arts and health into my personal practice as a doctor. So given that I work in a complex healthcare system, in a resource-limited country, in a resource-limited setting, it means that when I see opportunities like arts and health that allow patients to have more for less, then I basically grabbed it with both hands. I hope I've been able to explain that in a short time.
In such a beautiful way. And for context, for anyone who wasn't here, you participated in a really special event earlier this month, where it really speaks to the expanse of arts and health in Nigeria. Who would like to introduce themselves next?
Okay, I can go. I think I like stories, and I'm going to Shanaé, thank you so much for giving that prompt as well. I think my journey into the arts and health started with a personal experience when I lost my father, and I stopped dancing. And a couple of months after, my teacher told me, "No, you must come for dance class again." And I was like, "No, I don't want to dance." She's like, "Okay, just come and observe." And I knew it in my heart that when I'm going to go for my dance class, I'm not going to just observe, and I'm going to start moving. And I think that was the beginning of my healing journey. And that's how I moved from studying journalism to actually going back and studying psychology, as well as doing different therapy certifications, and then kind of got myself into doing expressive arts therapy. And it so happened that I landed up in a hospital setting for my internship, and my whole perspective kind of changed from just looking at therapy or therapeutic settings with the arts, but also kind of moving into a broader umbrella of arts and health, and really looking at how arts could be contributive along the bedside of the patients, going through like different kind of procedures and treatments. And so it seems like a journey of 12 long years. That's what's got me to arts and health right now. And it's just started with a personal story, moved into really looking at how professionally I could contribute to the field of arts, and to health, and then like really looking at the benefits and the joy and the color that it adds to something which is very linear, something which is more black and white. Or like just very, in an environment which is more not so colorful, I would say. So yeah, that's been my journey with arts and health.
It's so beautiful to hear. And for those on the call who I am familiar with, I write about this concept of grief love, how there's really no space between those words. We really have to name where it hurts to hold this question of like, what else can it be? And what better than the arts, right? To hold that question with us as we imagine and create space for this world that we're actively building. So thank you for the color to which you share in detail. And last but not least, an introduction from Yifan. Yifan, how did you end up in arts and health? And tell us a bit about yourself. Yeah.
Okay. Thanks, Shanaé. It's really great to see you here, and I love the color. Of the lips, yeah, looks amazing. So a bit about myself. My name is Yifan, and I think like many others in this meeting now, my journey also wasn't like a linear one. My academic path began at Peking University. I studied my school called Health Humanities, and one of the first thing we were told was the humanities are the other wing of medicine. And actually, that sentence stayed with me after like almost 10 years now. And over time, I've come to understand that just how necessary, the second wing or the other wing is if we want our systems to fly. And earlier in my experiences, I worked for biomedical kind of companies or like pharmaceutical companies and also healthcare consulting. And these experiences actually taught me how, the large healthcare systems operate and also how often they fail to answer the call for human-centered care. And I still remember like designing kind of frameworks to improve treatment access to patients with rare diseases. But at some point, I started wondering, are we actually building systems that, really care, or just systems that manage illness? And, this question actually shifted my path from consulting, from healthcare, from pharmaceutical companies to stories, to arts, and to imagination. And whether through music, through stories, through visual arts, all of them remind us that health and well-being isn't just about clinical diagnosis or treatment, but also about connection, about meaning, and about dignity. And today I sort of feel my journey echoing with some scholars called the waves of public health. So in the early waves, it focused on sanitation, focused on medicine development and behavior change. And now we're focusing more on social determinants of health. And some scholars start to arguing that, we're now entering a fifth wave, which is one that centers culture, care, and collective imagination. And that's, the wave I'm hoping to work to help shape and also I feel like most at home. Yeah, that's it.
Incredible. I mean, I feel so lucky to hear your stories in succession, to hear them together and interwebbed. knowing so much of it is like, I'm like literally tearing up because Yifan and I worked on a concept of, restful research, which is a talk for another day. But in like hearing these stories, I'd love to drop down a little bit deeper into maybe spotlighting one of the projects that you're working on. And with this question, then maybe you can describe something that you're working on and maybe what impact you see it having in your community in real time. And if you want to keep it spicy, you could maybe lift up a challenge. We have solutions within us and in this large group of people. So feel free to share whatever accelerators or breaks you're experiencing with this arts and health project that you want to spotlight today. Perhaps should I popcorn it, or does someone immediately want to jump in? Do you want to go in another order? Yifan, would you like to go first this time?
Yep, sounds nice. So actually, I'm joining you all from Singapore right now, and at the Center for Music and Health at the National University of Singapore in US, I help coordinate research projects that examine participatory music programs, whether it's community drumming programs or community choir that aims to support health and well-being for both university students, but also older adults and people living with chronic conditions. And I would say these projects are not simply creative workshops or interventions. Everything we do is about research. It's about building the evidence base, and we're using both like a mixed methods approaches, including like qualitative and quantitative, and also participatory research methods, to not just understand the impact in numbers, but also try to understand the meaning making process embedded in these practices. I think what excites me most is not just studying the intervention impact, but also working with different stakeholders and community partners to try to build the infrastructure that allows these interventions to scale up. We form partnerships across sectors. We co-design interventions and evaluation frameworks with our community partners, and we try to advocate embedding the arts into healthcare systems and also in a community systems. I think one current example is one of our upcoming event, which is called Healing Arts Singapore, in collaboration with Jamil Arts and Health Lab and WHO, World Health Organization. So this event actually brings together different stakeholders across research, across practice, and policy, and we just gather together to envision like how arts and health can look like and can be embedded more deeply into the systems of care. It will be happening in December, so stay tuned on that. And I think another example is the Chinese arts and health work that I founded in like almost 2 years ago. Because having the privilege to live and work in China, US, and Singapore, I kind of seen how the meanings of health care and even arts and expression can shift across different cultures. But there's like one thing that remains the same, that is, the human need for connection and the power of arts to reach where the medical systems can often not able to reach. So this kind of collective is aimed to kind of bring together, regional collaboration, dialogues, and knowledge exchange. And in terms of the impact, I think the impact is not only, lies in papers or like numbers, but also in those very tiny, small human moments. On this Thursday, I was at one of the community centers here at Singapore. They have this active aging centers, which embedded in the community and residence areas where they provide, health services, but also more than health services, but also, arts activities and exercises, things like that. And we're doing this community choir programs with them. And those, seniors are just smiling at me, even though we don't know each other at all, like 2 weeks before. So I think all of these incredible moments are just the impact of our work.
That's beautiful, Yifan.
Yeah.
Oh, please excuse me. I didn't
No,
mean to
no.
I didn't mean to cut you off, but that really just speaks to the masses, but also your particular experience in these various contexts allows for a shift in redistributing, right? The impact.
Yeah.
Uh, Akshata, would you like to share with us a spotlight of your project? I'm sensitive that we started a few minutes behind, but I'm not certain if we've been given more time. So maybe someone will DM me. But Akshata,
Okay.
please share with us what the one project is that you'd like to spotlight in this conversation.
Sure. I think I'm tuning in from Pune, India. It's in the western part of India. And one project that is really close to my heart right now is, and something that I've mentioned before in my introduction as well, working along the bedside of the patient. So currently we've come up with a booklet. And this is specifically, it's a research project specifically catering to individuals who are going through chemotherapy. And this is a 12-week project. All the prompts of the project has been given in the booklet. So it is an expressive arts intervention. So it uses music, movement, writing, visual arts, drama, all like literally looking at the interconnectedness of the arts. So every time a patient comes in for their chemotherapy cycle, we kind of present the booklet to them and they can choose the activity that feels the closest to them. And of course, all of them also have an objective of why a certain prompt has been given, considering the needs analysis, considering some information they've given us before, and then we work through those different narratives. And I think like this project has created a lot of arts and how arts can be beneficial for health and can be used as treatment modality, especially when we look at holistic approach to health, especially in a hospital setting when everyone is so concentrating on the physical symptoms and the procedures and the treatment. The arts really kind of help in bringing that holistic perspective. So we co-created this program with the patients, along the patients, as well as the nursing staff. And we are leading this project in like 2 different hospitals in Pune. I think this project is really close to my heart also because every time I go into the ward, they always are looking at like, oh, what material do you have for us? What are we going to do today? And some of the things that actually patients come and tell me is like, we come to the hospital these days only to see what new can we do today instead of just like concentrating on the treatment. And I think like Yifan also said, like, yes, research is a part of it, publication is a part of it, but I think these human experiences and these human exchange is like a bigger impact. And I think that's really beneficial and important. So that's a lot to do in the hospital setting, but the other part of it is the studio work, which is like bringing in the communities together, really looking at how the cultural aspects of Pune kind of come in together, and how can we use the arts, the folk art, the traditional arts that are there in our culture, in our tradition, because India comes from a vast cultural background, and how can we use the arts that we already know and have, and how can we use that and bring it back to the communities from a perspective of healing and from a perspective of just coming in together and connecting with each other. So I guess these 2 projects are really close to my heart, and something that we've seen that has grown over time as well.
There are so many layers to co-creation in this experience with the patients, with community members, with the full team. That's really exciting. Dr. Sanvi, we'd love to hear from you. Also sensitive about time, but take the stage and share with us a spotlight of a current project that you're working on. I know that you began to share in your intro.
Yes.
What would you like to share here?
I had a feeling this was going to happen. So in my intro, I already mentioned that a major project that is dear to me now is ensuring that in my own practice as a medical doctor, I'm incorporating art in health as possible. I'd also like to spotlight the World Health Organization Lancet series that was recently completed with the Jamil Art and Health Lab. It's really special to me having an opportunity to work on that, as well as the results that we've gotten from there. Not a lot of it has been, some aspects of it haven't been shared with the world yet, but we're still reeling from a lot of the, so to speak, discoveries that we've made from there. Because I mean, it's easy to say, oh yes, art can be used for non-communicable diseases, for prevention, for health promotion, but then actually seeing the tangible numbers has been such an amazing experience. Then the third thing I would like to mention, which is also very close to my heart, I'm calling in from Lagos, Nigeria, which is in West Africa. Like I mentioned earlier, it's a resource-limited setting, especially for healthcare here. So what I'm currently working on is as regards to mental health. So but a little backstory. The Mental Health Act law was passed, I think, 2-3 years ago. And basically, we've just moved from calling it insanity to calling it mental health or mental illness now. So we've just gotten to that point. So that gives you an idea of how much stigma, how much the name calling that and the stigma that is basically associated with mental health now. However, despite that we have a new mental health law, art is still not recognized as, like, art is still, it's not recognized in any way at all in the treatment of mental health, despite the fact that a lot of art and health actually went into ensuring that we have the new law now. So it's like we got to this point and then we find out, oh, a rule was passed, but art is still not being recognized as a modality for helping or for the treatment, prevention, or any aspect at all in mental illness or mental health. So currently, what I'm working on is, first of all, ensuring that maybe we've not been able to create enough awareness. Maybe we've not spoken to the right people yet. So there's a lot of that going on. There's a lot of liaising with mental health advocates, mental health bodies. Apart from letting the lay people know, I also want the people who are at the forefront of mental health and mental illness advocacy in Nigeria to be aware that, okay, there is something called art in health, and this is the way we can incorporate art engagement for mental health and mental well-being. So that's also something that is ongoing. And then thirdly, there's also the research aspect. We're trying to see, okay, how much research do we actually have in this space, not the global research, not what is happening in the US, what is happening right here where I am in my own community. So I guess that's it. Thank you.
No, that's beautiful. We actually were given more time, so we have time for this third question. And of course, I'll just invite people, if you do have questions emerging for our panelists, please drop them into the chat, and I'll see how I can bake them in. Again, thank you to our co-host for giving just a little bit more time to kind of sit with these projects, and in the context of thinking about the future. Which Alexis DeVow, a feminist, says is our next breath. What would you say, looking ahead, what would you say are your hopes for your work and really the broader field of arts and health? There's so much going on in the world right now in the context of this short conversation, but also in the span of whatever that point of time is for you, whether it's last year, 2020, or much sooner. I think that there are a lot of things to say. So what are your hopes for your work and the broader field? And Sammy, can we have you kick it off?
Yes, sure. So for my work, my hope for arts and health as regards my work would be for a situation where I get less questions about arts and health, not because I don't want people to be curious, but because I want arts and health to be actually known as a thing. Like, I want it to have its own, it's a budding field, it's an evolving field, it's an emerging field, but I cannot wait for the time when it is like respected, where, because I come in sometimes and then my patient is like, yeah, I know you as a doctor, but what's this one? Like, what's this practice you're talking about, So as much as possible, I can't wait for the awareness to become more. And then for the world, I'm also looking forward to a time where the youth, just bringing this in. I think, I'm not sure if this applies to other countries, but in Nigeria, I'm really looking forward to a time where the youth are involved in the policy making, in the actual nitty-gritty of things like art and health, where it's like young people are the ones pushing it. Young people are the ones making the rules concerning these things, especially for mental health, because in situations like that, there's almost a disconnect between, like, there's an intergenerational disconnect, so to speak, It's like a young person is saying something, but the older person is hearing something else. And I would really just like a time where maybe not calling the shots, but at least as a seat at the table. I'm truly looking forward to that. And so, and in general, just a better world, a world more accepting of art as something serious. I was reading a write-up recently about how you say arts are not, they're not serious like the science, but then at funerals you read poetry. When you're happy, you sing songs. When you feel tense, you dance. So it's like we know instinctively that arts it's a part of us. It's something important. It's like the essence. It makes life easier. It makes life worth living. But at the same time, there's the rational part of maybe of the human experience that just wants to reduce what art is or what art can do. So I'm truly looking forward to a time where there's a balance, basically. Thank you.
Thank you. I'm looking forward to that too. Akshata?
Yeah, I think I totally resonate with what Sanmi has to say. I think like a lot of my work goes into explaining people what I do constantly. And I think I want to I'm hopeful and I want to live that day where I don't have to tell people what I do. And we just kind of come in together to create and have fun and express through the arts. Whether it is communities or specific populations, I'm hopeful to looking at how arts can be integrated into all kind of systems, having a systemic change in a more holistic approach to health, looking at policy changes. So absolutely like looking at getting everyone together for creation, for healing, and definitely not explaining myself what I do. I think that's a big part of the hopes for the future, just to create a more holistic approach to health.
Thank you. And last but not least, Yifan.
Thanks, Shanaé. Like beautiful statements, cannot agree more. And for my hopes for future, I hope we move toward a health system that are not only more equitable, but also more imaginative. And I also hope funding, education, and policy frameworks can evolve to support creative and arts as a long-term infrastructure for creative care and not just, isolated interventional programs anymore. And I really hope we can recognize that arts not only as tools for expression, but also as a blueprint that for how systems might learn to listen and adapt and dignify. And I think I also want to thank for all the incredible mentors and collaborators who've helped shift my journey, whether it's in China, in US, or in Singapore. And this work can never be done alone. And this work requires like many literacies across different interdisciplinaries. I think the more we allow ourselves to move across these kind of registers, the more we can help to shape a public health that is not only evidence informed or evidence based, but also culturally grounded and emotionally resonant. Thank you.
Wow, truly, truly an honor to be in this world with you, to know that in these various corners of the earth, your direct communities get to experience your vision, your drive, your love, not only of art and health, and really the ways that by your existence, you're converging this Venn diagram really to a whole circle, to speak to the wholeness, to speak of the adaptation, the systemic change, and also the reality that, We're arts and health scholars, researchers, practitioners. We are at the front lines. And what that means is that we're changing the atmosphere. So thank you for allowing us to listen to your stories, for creating a helpful narrative. I hope that those on the call are inspired, empowered,